So today, we'll be starting our session on communication. The session communication is per se is divided into different sessions. So today's topic is part one of this communication. You are familiar with Dr. Sunil sir. So in this session, sir will be covering about need of medical communication, barriers to effective communication, steps to effective communication, differentiate between good and poor communication, and developing listening skills. Very important in palliative care because, as you know, communication is the key to understand, the key to open a patient's emotions, feelings, what he is going through, and to understand his world in the best possible way. Welcome you, sir. Over to you.
Thank you, Anu. And good afternoon, everybody. Am I audible? Am I audible?
Yes, sir.
Yes.
Okay. Okay. So, I'm sure all of you will agree with me that it is important. And Anu also told it's an important aspect in palliative care, not only in palliative care. So, I would like to hear from you. Why do you think communication is important? I would like all of you to speak. Otherwise, it will be very boring. Yes, I am a sister. Please unmute. Please unmute yourself.
Yeah. Good afternoon, sir.
Yeah.
Whatever the treatment we are giving it to the patient, unless and until we communicate with, whatever the feeling and pain, how much he is getting, will not know.
Yeah. Very good point. Yeah. Anybody else? So all of you are working in some of the hospitals or in a clinic. So in your team, there will be many members. So who all should have the communication skills? What do you think? Who all in your team should have the communication skill? Anybody? You can speak anything. There is nothing called as wrong. So who all should have the communication skills? Our session will not go forward if you don't speak. Among all members of the, yeah, I can see some titles in that work on all members of the healthcare team. Yeah, that's very important, isn't it? Because when you enter a hospital, the first person whom you are going to see is the security person. If he is not going to behave properly, then the problem gets started. And then you will be going to the reception, and there will be, after that, there will be nurses, doctors, paramedicals, and many employees. So, if the chain breaks in between, that is going to affect all of you. So, all the members in the team should have proper communication skills. So, I just want to explain it with one of my experience. So this was a 48-year-old lady who had a carcinoma of the breast. And as you know, the treatment for carcinoma breast, she has undergone mastectomy followed by radiotherapy and chemotherapy. And she was actually a housemaid, and she was actually from Kerala, but was working at Tamil Nadu. And even though she had this carcinoma breast and underwent treatment, she still was working as a housemaid in Tamil Nadu, and she didn't have much problem. But after a few years, she developed breathlessness. But even though she met a few doctors, she didn't got proper pain relief. She didn't get proper relief of breathlessness. So, uh, she decided she will come back to Kerala, and even she went to see many doctors, and at last somebody referred this patient to us. So when this patient came to us, she came in a car, and ours was a small palliative care unit, and the patient needed to climb by few steps. When I saw the patient, even when uh, she entered or got down from the car, she was very breathless, and then she had to climb the few steps. So when I saw this, I actually pulled a chair and asked her to sit down in the veranda itself, rather than going into the consultation room. And after this, after settling some of the breathlessness, I actually took her to the room and gave some medication. And after maybe half an hour, this was what she told me. Our doctors and nurses don't know how to behave to patients. My voice is not clear. I can see some chat response. Is it clear now? Can somebody respond?
Yes, it is clear, ma'am.
So this was the first thing that the patient told me. Our doctors and nurses don't know how to behave to patients. So what is your response for what the patient told me? Jasmine says yes. So you agree with this statement? Anis PV sister says yes.
Yes.
Yes, Sister Lindsay. So, are you saying that we don't know how to behave to patients? So, are we like this? A horrible organism with thorns. Huh? So that's why patients tell that the doctors and nurses don't know how to behave to patients. Okay, this is one of my experience, and I'm moving on to another situation. So this was about a patient, a young patient who was actually diagnosed with SLE, that is systemic lupus erythematosus, and she had uncontrolled diabetes mellitus. So we tried our best, but we couldn't control. Okay, I can see there are a few opposite or disagreements from Tivakar and Laurencia. Yeah, but we will move on. So this patient was SLA, having SLA with uncontrolled diabetes. And we were working in a multi-specialty hospital then. So I took this patient to an endocrinologist. So in the OPD, I was sitting with the patient in the doctor's room. And one of my nurse also accompanied us. She was standing behind the door inside the consultation room. And after some time, the nurse who is posted in the OPD for helping the endocrinologist came, and she opened the door. Okay, and it hit on the nurse who was standing behind the door. So if you were the person who opened the door, what would be your response? Suppose you are the person who opened the door. What would be your response? I'm sorry. Yeah. Sylvester says, I'm sorry. Okay, sorry.
Yeah, sorry to hear.
Yeah. Any other comments? I can see 3 comments with sorry.
Did you, hello,
Yeah.
did you heard with my this actions? Very sorry.
Okay. Yeah. Okay. But then that was not the response of that nurse who opened the door. She was like this. You know what she told? Instead of saying sorry, she told, sister, don't you know that you should not stand behind this door? That was the response from that nurse who opened the door. Okay. So a doctor, a nurse, they were behaving not in a proper manner. Okay. So in a palliative care team, usually there will be doctor, nurse, and mostly there will be volunteers. Okay. And as you told, there will be many of the team members, but I am talking about a small palliative care center where there is a doctor, nurse, and a volunteer. So this is another situation where a volunteer accompanied us for a home care, and that patient had a carcinoma of the lung. So, what is the proven cause for carcinoma of the lung? Or one of the causes? Yeah, smoking. Yeah, this volunteer was also very well educated, so that he knows that is smoking is one of the main cause for carcinoma of the lung. So this volunteer, during his conversation with the patient, he asked the patient, "Do you smoke?" And the patient told, "Yeah, I was smoking, and I stopped when I found to have this disease." That was about 2 weeks back. And then the volunteer had a particular expression in his face. So, what do you think? Do we actually need to ask this question? Do you smoke? Is it good or bad to ask this question? in this situation? What is your opinion?
No need to ask.
Sorry?
No need to ask.
Okay. Suppose this volunteer asked this question. What could be the after effect?
Patient will feel like, he's being done some big mistake.
Yeah, that's it. So the volunteer is making the patient uncomfortable and making the patient guilty, isn't it?
Yes.
Because
Yes.
I have smoked
Yes.
and because of that now I have cancer. So these are something which so these are three situations in which I wanted to convey you that everybody in your team should have proper communication skill. Okay, and we will move on to the advantages of proper communication. So it is actually beneficial for not only for the patient but also for the society as well as for us. Okay. Um, so when we treat a patient, the patient should comply with all the treatments. Suppose you give some amoxicillin 3 times daily, and the patient take only once daily. Then there should be the patient may not have proper relief of symptoms. So, in order to comply with medical treatments, we should have proper communication skills so that patient will get good symptom relief and we will be one of the big doctors because the patient got good relief. And nowadays, there is lot of strained relationship between the patients, family, society, with the medical profession. So, if you have a good relationship, which can be established by proper communication, then the strain and stress will be less for us. And if you look at those physicians who has roaring practice, there will be two types of doctors. One is the one group is the doctors with highest knowledge, and everybody will refer the patient to that doctor. And there will be another group of doctor who properly communicates with the patient. And so if you are satisfied with the communication of that doctor, then you will tend to go to that doctor for consultation. So from our point of view also, if we properly communicate, we would have good practice. And from if as nurses, the patients will be looking for you whenever they come to a hospital. So it's also important for us, or it is also beneficial for us. Okay. And for the patient and family, we know once the patient get admitted in a hospital, they would not know what is going to happen next. So there are many stories from the patient who even didn't know that the one of her leg is going to be amputated. They knew only after came out of operation theater. So we actually need to give a direction in which the patient and family need to go. So it will help to reduce the uncertainty and will also help the patient and family to plan what treatment is necessary. And if something happens in the future, what we need to do. So it is beneficial for the patient and family. And we know that, as I already told you, the strained relationship between the society and medical profession. So we need to, if you communicate properly with somebody, that person is going to the community and he is going to probably tell to one of his neighbors that there is a good doctor, there is a good nurse. You can go and consult them. The other doctor is not good. So this is going to create a good relationship if you properly communicate. Okay. So I just want to ask you, the previous patient, the first patient with the carcinoma of the breast, who told me that doctor, our doctors and nurses don't know how to behave to patient. Why did this patient tell me this? Why to me?
She found that you are listening well to her and responding in a good way.
Okay, but I would like to tell you that actually I didn't speak to her because she was not in a position to speak when she came.
A patient wants a humble facial expression as well. They can recognize who are onto their side.
Okay, thank you. Any other comments?
She felt that you are feeling with her feeling.
Okay, yeah, probably because when she was very breathless, I pulled a chair and asked her to sit down. So that might be the act which, yeah, your gesture, Jasmine says, your gesture. Yeah, yeah. So uh, I would like you to watch a video now, and please watch it carefully, and um, I will ask some questions.
Mr. Arun Kumar is suffering from lung cancer.
Those who has not spoken yet, please. Yeah, Sister Nida.
We have
Yeah.
The nurse's good approach itself. The patient is relieved half of the pain.
Okay. Yeah.
She had a good listening heart.
Yeah. Yeah. Good understanding about the patient, good listening, concentrate patient feeling, pain, care, supporting. Yeah, good communication, good facial expression. Yes. I can see Sister Anika.
And she
Sister Anika.
Now she communicated nicely, and what is the pain also relief from the patient a little, and also she spent time when the phone call came. She told, "Please wait. Afterwards, she will call." Like that, so many things she has done. So they were happy.
Yeah.
to hear.
Ma'am, Baba sister.
Sir, this time she has.
Please unmute yourself. Please unmute. Please unmute.
Yes.
Yeah. You can talk.
Like, yeah, this time she was very much conscious about whatever she was listening, doing everything. But she neglected one more thing, the patient was sleeping in that position only. The wife has fed the medicine. She did not ask the patient to sit and have the medicine.
Okay. Okay. Yeah. But all of you agree that overall it's a good communication video, isn't it? Okay. Yeah. So we will move on. We were talking about the first patient who had carcinoma of the breast and came with breathlessness. And she told me that the doctor and nurse don't know how to behave to patients. So probably somebody told that it is my gesture that made the patient to tell me that sentence. So actually, I didn't speak to any that patient, but that non-verbal communication itself, that was enough for the patient to tell me that. So, what do you think in a communication, which component is more, non-verbal communication or verbal communication? It's both. But if I tell you that you have to give more weightage to one, which one would you give more weightage?
Non-verbal.
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 Okay. More of non-verbal. Yes, it is more of non-verbal. Okay. So when it's the research about communication says more than 80 to 90% of our communication is non-verbal. So whenever you speak, you are not speaking only with your mouth, isn't it? So you are using your hands, your facial muscles, your body, all the parts of your body are speaking to the patient. So it is more of non-verbal communication. Okay, and what are the different aspects of non-verbal communication? All of you might be knowing, but I am just going through. The first and foremost, or one of the most important aspect is eye contact. So, if you speak to a person and eye contact doesn't mean that it is going to be, you are going to stare at the patient's eye. At first, when you start talking, you will just look at the person's eye. That is to catch attention. And after some time, you will then concentrate your eyes on the patient face, not on the patient's eye. That is an invitation to start conversation. Okay. So eye contact, then body language. All of us know body language is very important. I can give you an example. Suppose everybody is. I hope many of you travel in bus, and all of us like the side seat, isn't it? So suppose you are traveling in a bus, and all the seats are filled except one. So there was a side seat. You sat down on the side seat, but after some time, another person came, and on the first look itself, you were saying to yourself, "No, no, that person should not sit with me. He seems not a hygienic person, or I don't like that person." But there were no other seat. This person came and sat down with you. So what would be your response to that person? What would be your response? Feeling bad, okay. What else? I may move, yeah. You will move to the side like this. So the other person will sit more comfortable. So you will again move little bit, but there is no space. So after some time, what will happen? You will just turn like this, and you will also hold your hand in front of the other seat like this, and you may look at like this rather than looking like this. Okay, so your body, what is the message you are conveying? I don't like you, isn't it? So that's the importance of body language in day-to-day practice. And posture. So it is said that when you see somebody, you should sit and lean forward. Okay, that is the good posture. And position, as far as possible, we should sit, both the patient as well as the healthcare person. Then there is something called as buffer zone. What is buffer zone? Can anybody tell me what is buffer zone? Buffer zone. Okay. So suppose you are going for a party. Okay, there will be many type of people. Somebody totally unfamiliar to you, and some of the people you have just seen but have not talked, and there will be some of your friends. So when you see the unfamiliar persons, what would be the distance between the unfamiliar person and you? Will you will you go very close to that person? No, you will not. But when you see your friend, you will go very near to and may touch on the person, your friend. There is some buffer zone is also known as comfortable zone. So around our body, we have some space which is our own, and we will not allow the persons to enter into that space, or we will allow the people to enter into the space depending on the intimacy that we have with the person. So an unfamiliar person, when they cross the comfortable zone, we will feel uncomfortable. But if a friend come to me, I will not feel uncomfortable. So whenever we see patients, this is applicable. You can see some patients when they come and sit in front of you. Some of them might be sitting like this at first, and when you come and sat down, some of them might go like this. That means the distance between you and the patient is not proper. You have actually intruded into the comfortable space. So you have to see these things. Okay. And your tone of voice, it is very important. And all of you know, touch is very important. And when you are when you are very much worried, a touch can give you much relief. So these are some parts of non-verbal communication. Okay. This is another case scenario. You are seeing a patient called Mrs. Rema, who is a 48-year-old woman with carcinoma of the breast during home care. And you were actually talking to her, but suddenly she told you that I am afraid. How will you respond back? What would be your response? Please give your answers in the chat box. And if anybody want to speak, please unmute and speak. I can see only one response. Hold her hands and ask the cause. I would like the exact sentence. What you suppose you are the person you are who saw this patient. So what would be your response?
Can I ask her what making you to be afraid?
Okay. Sister Jasmine says, hold her hand and say, don't be afraid. Anusha says, what are you thinking, Laurencia? It is natural to be afraid. So I can see there are many responses. So suppose I know all of you are giving this answer because you want good things to happen to this patient. You want to support this patient, and that's why these answers are coming. But what you have to understand is, suppose this person, why did she tell that I am afraid? We don't know, isn't it? So actually, we can't say you need not be afraid. you might be thinking that she is afraid because thinking about her cancer and things like that. But she might have told you that I am afraid, thinking something else. So we don't know what is in her mind. So first of all, we have to find out why um, she is afraid. Okay. So the proper response would be, what would be the proper response? Okay, this is once proper response you have to actually find out. So, as somebody told, you can wait for some time, because maybe a few seconds the patient may herself come up with why she is afraid. If not, you can actually ask, can you tell me why you are afraid? So that's what you have to do in communication. Find out, explore. So every time you ask the question, why, what. Okay, so it is important for us to understand that there are something which we should not do. Okay, so what are the things which we should not do in communication while communicating with the patient? Can somebody tell me some points?
Not to give any unrealistic answers.
Yes, unrealistic answers. Yeah.
Don't blame the patients for anything.
Yes, don't blame. Yes, and preoccupied mind. That means you should not be judgmental. Okay. Yes. Sister Anita, want to speak? Please unmute her. Sister Anita, please unmute yourself. Yeah.
Same thing only.
Okay.
Communication. This don't be judge. Don't blame to them.
Yeah. Should not use medical terms. Yes.
Yes.
Okay. So one of the important thing is don't assume. So in the patient who told you that I am afraid, you told don't worry, because you assume that this patient is telling I am afraid because I have cancer. You did not find out why she is afraid. Okay, so you should not assume, and you should not give false or premature reassurance to any patient. There will be many patients with advanced cancer will ask you, sister, I will, this disease will cure, isn't it? So you should not be giving premature reassurance saying that, yes, after this one cycle of chemotherapy, you will be okay. You should not tell that. And another thing is, you should not ask leading questions. So leading question means, suppose a patient has severe pain and you have given some medication. Okay. And next, what question would you ask this patient? Or actually, what do you want to know about this patient? You want to know that the pain has reduced. That's what we want, isn't it? So for getting that response, you will ask, your pain is reduced, isn't it? So most of the patients will tell, yeah, but that's a leading question. You are actually prompting the patient to say that, my pain is reduced. So that type of question should not be asked. And you should not be paternalistic. Paternalistic means,
Ask the patient that, did you sleep? What did you eat?
sorry. Paternalistic means the relation between a parent and a child. So, as medical professionals, many of the people just tell the patient, okay, you have to take this, you have to do this. And we should not do that, because patient is also a person. They are also having same status of ours. So we should consider them as a person with equal status. Okay. And somebody has told, Christy has told we should not use the medical term. That is medical jargon should not be used. You may tell a patient that you have bronchopneumonia and you take levofloxacin TID in the 5 days and come back after 5 days. So what as a layman, patient may not understand anything. What is bronchopneumonia for them? What is levofloxacin? You have not given any explanation. So speak in patient's language. Okay. And don't blame the patient. Okay. So those were the don'ts in communication. Now we will move on to barriers to communication. I will just rush through. There might be barriers in the environment. Even medical professionals can be a barrier to communication, and patient can be a barrier. So lack of privacy. We know that in many hospitals, especially in government hospitals, there will be many doctors sitting together, and patients would be coming, and they will not be able to express or they will not be able to ask whatever they want because there is no privacy. So that's a communication barrier. And physical barrier. If there is a suppose there is a table which is very long enough so that a doctor is sitting this side and the patient is sitting on that side, then that is also going to be a communication barrier. And this is the phone. This is the most common communication barrier nowadays. Even you saw with the Asha that phone was ringing, which was again a communication barrier. And the patient can be a barrier because of timid nature. Some patients may not speak at all, so that is going to be a barrier. And they might think that this doctor might be busy, so that might be. And if they have non-medical problems, I am unable to. I haven't gone for work for the last 5 days, so I don't have any money to buy medicines. So they will think that how can I tell my non-medical problems to the doctor? And we know that there are many diseases affecting communication, such as carcinoma of the larynx, throat, or even tracheostomy. All these are communication barriers. And can you be a communication barrier, doctor and nurse? So our appearance itself can be a barrier. So a person with tie and a coat, the patient might think that, okay, it's a very big doctor. We cannot speak anything to him. And our uniform itself can be a barrier. Suppose you see a policeman when you go to somewhere, and you will be a little bit hesitant to walk that way, even though you have not done anything. But if he is not in uniform, we even do not know. We will not care him, isn't it? So like that, patient will also be like this. So uniform or stethoscope can be a barrier, and our facial expressions. And many of us, many doctors may think that, okay, I have been practicing for last 25 years. I don't think it is important. And I'm a very busy practitioner. I don't have time to communicate with the patient. So these are the doctor's attitude. And many of the doctors and healthcare professionals do not have the aptitude for the communication because we are not taught during the medical schools. And we don't know how to communicate a bad news to a patient. The patient is diagnosed with a cancer. How should I communicate with the patient? What will I do if the patient cries? So these are some, we do not know how to do that. Okay. And what shall I do if the patient starts crying or if the patient is angry at me? So those are the barriers in the environment with a medical professional. and with the patient. And okay, so I will show you another video. And I told you what all should not you the don'ts in communication. But now we are going to watch another video in which what shall we do. The only thing what we should do is active listening, and how you should do that will be dealt in this video. Okay. What is an open question? An example, how do you start the communication with the patient? Yeah, Sister Anita, please unmute her. Sister Anita, please unmute and speak. Yeah.
First,
yeah.
we got to ask the history. What is his name? Where he coming from? Where? And how many children? History, present history, we can collect first.
Yes. Yeah.
Yes.
So
Then-
after greeting the patient, you can introduce yourself. Who are you?
Yeah.
I am Sister Anita. I am a palliative care nurse. Yeah. So the next thing is you have to ask an open question. So I can see there are open question. How are you feeling today? Yeah, that's a good open question. Or how are you? That's the question by which patient can talk about anything. Mostly patient is going to talk about their problems, but this is an open question. Okay. Yeah. Next.
More focused questions to
What we have learned regarding the non-verbal communication, what are the don'ts, what are the do's you should do. So all those are given in this video. So first of all, you should greet the patient. Then both of you should sit. Then you can introduce yourself, who are you, and you can also identify the patient. Then you can ask an open question. How are you feeling today? Or how can I help you? So with that question, the patient will come up with his or her problems. So after that, you have to go according to the patient's verbal and non-verbal cues. And if you can actually clarify, and it is important that you should not interrupt in between. So you can clarify, but as far as possible, if you interrupt the flow, then you will take more time. So let the patient speak. And we know that we have only 1 month and 2 years. So our duty is more to listen, not to speak. Just give the ears to listen. And then you can clarify your doubts. And if the patient has any emotions, then you have to address it. That we will come in the next class, how to address the emotions. And always you should be having empathy. So what is empathy? What is empathy? Empathy.
Feel with the patient.
Feel with the patient.
Yeah. You feel the same way the other person, isn't it? So the patient is having pain. So you also feel pain inside you. Not you need not express it, but you also understand. You have to make the patient understand that, okay, I understand your problem. So that's what empathy is. And you can actually make empathic response. Suppose a patient is crying after hearing that he has cancer. What would be an empathic response? So you name the emotion and then connect it with why he is in this emotion. So what would be the sentence like? Name the emotion and connect with the reason. So how do you do that? Name the emotion. The patient is worried, isn't it? So that's why he's crying. So you are worried. Why he is worried? Why he is worried? By knowing that he has cancer, isn't it? So that's an empathic response in that situation. You are worried after hearing the news that you have cancer, isn't it? So that's an empathic response. So make use of this empathic response, because then the patient will understand that you are actually a genuine person who is really interested to take care of the patient. So you will deal with the emotions, and then you have to summarize. At last, you can actually summarize what all has been talked and what all has been planned. Then you can close the interview by giving a follow-up date. So that's how you do a interview or communication with the patient. Okay. So I think we have to stop now. And if you have any doubts, you can put that doubts in the chat box, and we will move on to the patient story.
I request Sister Annamol Anthony to share the case discussion. Sister Annamol Anthony, you can unmute yourself.
Yeah, I did.
You can introduce yourself also.
Huh? Sister, you can start with the presentation. I think you can see the slides. Good evening. Good evening to all. Can you hear me?
Yes, we can hear. Please move on.
Yes, sister.
Sister, please unmute yourself. Yeah, now speak.
62 years, female patient, diagnosed with oral cancer. Presenting complaints. Apparently, well, 6 months back, noticed an ulcer. It was 1 centimeter. Rapidly progressed. Size of 4 into 3 centimeter over 6 months. Mild pain, non-touch, and increased sensitivity to spicy in that region. No complaints of losing teeth, no complaints of bleeding or pus discharge from the lesion. No complaints of trauma and dental intervention. History of illness, past history, no complaints of tuberculosis, no complaints of surgery in the past, no complaints of drug allergy. Present history, mixed diet, normal bowel bladder habits, normal sleep pattern, tobacco chewing, ulcer inner aspect of cheek, mild pain, sensitivity to spicy food, no history of head and neck malignancy in the first degree of relatives. Examination. Patient is conscious, alert, cooperative, well-oriented, well-hydrated, pulse 88 per minute, right radial artery, BP 120/80 mm of Hg, cervical limb adenopathy present, no teeth closing, no bleeding, pus discharge. Examine the lips and mouth to look for abnormalities, areas of irritation such as sores and white patches. Treatment and significant investigation, wound care, nutritional supplements, radiation given, surgery done, antibiotics given, vitamins tablets given, rail tube feeding, blood transfusion. An investigation, biopsy, blood test, X-ray, CT, MRI. Psychological aspects, Mrs. Agatamal, 62 years old, affected with oral cancer. She has 5 children. She belongs to poor family. She was working as a cook in the higher secondary school. After surgery, she was feeling bad to face relatives and she has financial problems. Medications, tablet Ferropenum CV, PD, tablet LIMS, OD, tablet Hyphenac, BD, tablet Neurobion, PD, Ban 40 PD. Main concern, wound care, rail tube feeding, nutritional supplement. Summary, patient condition is good. Wound was progressively healing. Now she is taking chemotherapy. Discussion points. She is feeling ashamed to face others and financial problem. Thank you so much.
Can anybody start discussion? So how do you address these two problems? The patient is feeling ashamed to face others and she has financial problems. So how are you going to address these problems?
Can I show the patient photo?
If you have permission from the patient, then you can show. Otherwise,
I have patient photo. I did not ask that.
no, you should get the patient permission to show the photos. Otherwise, you should not. It's part of our ethics. And as far as possible, don't give any identification marks of the patient, including name, photos. But if you have taken permission from the patient to exhibit this, then it is okay. Otherwise, you should not show this any identifying mark.
Because her face, the jaw is taken during the surgery, and from the breast they have taken the muscle and kept the they did surgery in the right cheek. That's what it was, a biggest one. It is hanging like this. That's what she is feeling to face ashamed to others.
Yeah. So what can be done? Anybody has any idea? So when our body image changes, we would feel ashamed to face others. That's a natural phenomenon. So what can be done? Sister Mehbooba?
Yes, she can put some mask or covering onto the face.
Eh, Yeah, that's something can be done, because nowadays everybody is wearing mask, isn't it?
Yeah.
So
Yes.
that's, yeah. Anything else?
It's bigger than mosque cannot cover.
Okay, okay.
She can apply some bigger one, like, scarf and all.
That's also she is feeling.
One thing we must say, if her life is saved and she is now healthy enough to uh, uh, enjoy the rest of the life.
Yeah. Anybody?
We can reassure her.
Sorry?
We can reassure her.
Reassure
And give
her.
some
So
support, psychological support and some.
yes, but what are you going to tell her for psychological support? So this is very difficult, isn't it? I don't know whether any more surgeries are possible to rectify those defects. And maybe one thing what we can do is help her to meet with some of the patients who has undergone this surgery. So a peer support group will be able to help her, because then she will know that how the others have gone through this. So they might tell something else, and that can give some strength to this patient. I think that is what I would advise. So if a mask cannot be used, then next thing is surgery. If that can be done, I am not sure. And the second thing is peer support group. And financial problems, all of us know what can be done for her. I don't know whether you have any support from the volunteers. Do you have a volunteer group?
Yes.
Okay, so can they help her financially?
Yes, we are helping.
And maybe the financial help means you need not give money to the patient. It would be even dangerous, because they might have taken loans from many people, and if you give money, this money is going to that people. So don't give money. It would not be a good idea, but maybe monthly or weekly ration, and probably some rehabilitation for the family. I see that she has 5 sons. So if any of them can be given a rehabilitation according to the family needs and the environment, that would be good, so that it will give consistent income for the family rather than giving money to the patient.
Doctor told
Yeah.
she will be undergo another surgery to keep lips and all.
Okay.
So after chemotherapy, they will see to it.
Okay, that's good.
6 or 7 chemotherapy after, they will see to it.
Yeah. Good. Sister Anita? Sister Anita?
Yes, we have
You
to
want-
find out financial problem, I want to say, because in the church and all, we used to find out some benefactors and ask money from them and help the family, that the children, those who are studying, and for the treatment, sir said, for treatment, we have to buy the medicine and used to give. instead of giving money. So
Yeah.
like that financial help we used to do
Okay.
in
Okay.
our places.
So what
Thank
are
you,
the children doing?
If they are studying and all, we have to help for the study. They have no income, so we have to help the children for study.
Any of the children are studying?
No, no,
No.
they all got married and they are settled.
Okay.
We are helping in our parts from our congregation. No? We are helping.
Okay. Okay. Yeah, that's good. Anybody else want to make any more comments? So what I want to stress from this session is non-verbal, the aspects of non-verbal communication, which are very important, and always you practice that. Only if you practice, then only you will experience the benefits of non-verbal communication. So yeah, thank you.
Thank you so much, everyone.
I think we can wind up the session for today. Thank you all for joining us today, and thank you, Dr. Sunil. It was a late-minute request, even though you accepted it. And thank you so much for being here with us. I'll be sharing the feedback link in your WhatsApp group. Thank you all for joining us today. Bye bye.